Well, greetings again from beautiful Glen Rose, Texas, and where the dinosaur tracks are. They were made 6 or 8 million years ago, and you can still see them. You have to dig up certain areas in Glen Rose to see the tracks, but there's a park here showing these videos, showing you the actual tracks that was made. Some of them were like 3 feet long. There were huge tracks in there. But anyway, that's not what I wanted to talk about today. But come to Glen Rose and you can see those. That's what we're famous for. Now, they're general dentist things. I'm trying to pick out simple, easy things you can do as a general dentist, or starting out. Anybody ought to know how to do these things, and don't let them sit. Now this type, when you're doing this, where you've got permanent teeth coming under the deciduous teeth, is a worse problem, because the permanent tooth, the cells can eat away the roots of the deciduous tooth, and you'll lose the deciduous tooth, and then this permanent tooth comes in over your bicuspid, and you have a real crowded problem come up. So you should be able to do that. So if you can upright a tooth anywhere, you can upright a ectopically erupting. They put this big name on there, but it doesn't make it a difficult thing to do. So let's watch what we did with this young lady. She had a wonderful personality. It was real friendly, and we joked and talked with her, and you have a chance to kind of have something to do with these young people's lives going up. And I have your assistants trained to help and encourage them in anything that they're doing. So she's a neat little gal, and she had this ectopically erupting tooth back on the lower right side over here on this side, you see it. And it's coming in, ectopically erupting. Now, you really didn't have to put any brackets on this at all. You could do it like that case before that. You could just bond this wire on the tooth, and bond it here, and bond it here. Just have to etch the tooth, put the wire up, put some dots of a good composite there, and just push the wire down into it and touch it with a little liquid, and you can bring the acrylic over these wires, and you have it where you're going to have the hook come up. Always put the hook right behind one. As this tooth uprights, it's going to go back that way. This hook's going to slide back down the line here. And so you take electrosurge, and every dentist ought to know it. You can do it with the other ways, but I like to use electrosurge. And it cauterizes the tissue, gets the blood stopped there and etch it, and you can put this little bonded hook onto that tooth. So we'll show that. And this tooth is sitting like this, and it's eating the root away of that deciduous tooth. Now, here is this tooth all straightened up now, and this hook that was here slides back on this wire. As this goes up, this tooth will move back, and now you can keep some of this force on it, and hook something in here and put some elastic, and you can pull the tooth right up, and this tooth will be sitting right in here, and the roots will be parallel. I'm sorry, I've got that thrown out there. Let me get over here and get my deal again. Okay. Now, this pushes this back, and then you can pull it up against it. Now let's look at it on the x-ray, and it'll be better. You can look down here and see You know, every dentist ought to have an electrosurge or a laser or something. I like the electrosurge. You just go in here and uncover this tooth down here. You take that away and it stops the bleeding too. And you etch the side of this tooth and put a tube in there, preferably a rectangular. In fact, it really ought to be a rectangular tube, and you use a rectangular wire. And you come in here, and this wire will come in here, and you drop down and bend it. And here I think we had 2 rings, and then we came off this side, which would be going down here, and you can't even try it in to get your hook. So you tie it off, and then you slide that in there. Now here is what we drew, showing the patient what we were going to do actually. Should have just bonded this like that. Now this permanent tooth, ectopically erupting, is nothing but a permanent tooth that's coming in under a deciduous tooth. Now if you leave it alone, which is so stupid, they don't want the pediatric dentist to do this, and this should be done by everybody messing with kids ought to know how to do this. And they can. Now if you leave this alone, this has already absorbed the root over here, yet the nerve is still alive in the tooth. But this will come over and eat this away. Then this tooth will just fall out, and this 6-year molar will come on in like that. And now, when this bicuspid comes in, you've got a real problem. Most of the time, they never do push this back, because as this comes on up here, this one falls in behind, and the wisdom tooth too, and you've got a problem. So when you see this forming, you go in and do this. And I don't care, I just don't understand the pediatric departments. Don't even want their dentists they turn out to know about this. And it is an essential thing to me that a pediatric dentist or anybody, any dentist out there anywhere that's working with children. And that's what I went to this little town, and there was no pediatric dentist, there's no oral surgeon. I did it all. And I learned how to do that. And I am passing it on to everybody anywhere in the world. That ought to be what you learn how to do. So you cock this thing up, and I'll tell you this tooth will move back, something like that. And this hook, where you hooked here, will slide back down here, and that too. You just keep this pressure on it, and keep pulling it up here, and you align this tooth up. It'll be sitting right in here, with the roots comes down. And that's where it ought to be. Now we're going to upright it and get it before it loses this, before we lose this tooth. The space maintainer is going to let these teeth come in properly. All right, there it is, half, almost up there. You see, there's no root. Don't try to upright this by prizing off of this little old tooth here. It has only one piece of root. So you start pushing this one down, and it's actually pushing the tooth, and there's enough force there to shove this back. Now, here the tooth is. It came from down here somewhere like that. And ectopically tooth, just a big word there. You got a tilted tooth coming in under a baby tooth, and the cells in the follicle around, there's a follicle around this tooth, and it comes in and it comes in open, breaks it down, and this follicle ends up in the epithelial tissue around the neck of the tooth. Now, this pushes in here, and it comes out. You leave this, once you get it out, now tie back here with an elastic, and they come up and wrap around the tooth up here. Don't try to pull on there. And pull this tooth forward, and you still got this force that's putting to bring that root back. Now let's see if I did that. There it is, right there, again, and it looks bad, but it is not. It is a simple, easy thing to do, and all you need is a bonded tube, an electric surge, and some piece of rectangular wire that'll fit in your tube. And you just bend this thing. You just come in and you drop around like that. And you stick this back in this thing, but you gotta push it up here so you can try it in to feel out where you're gonna put this hook. And there's a little spring that we used. You just come in here and you bend it, and then this one's going the other direction, but it's still the same way. Come up over here. Now this part right here, this is upside down. We had to pull this down. It tightens that spring, and that spring has plenty of force. It'll bring those teeth up. It'll shove the 6-year molar erupting, it'll shove it back, and it'll shove the wisdom tooth and that back. Now there it is, and you slip it. Now this hook slid from here to there, and that's the same little spring. There it is, we started to do it. There's where it was. And it came up like that. And that let this little girl's teeth come in properly. And the people that run the pediatric dentist don't want their dentist to do this. I think the thumb is on the pediatric dentist and at the universities where this is taught, everything, to stop the pediatric dentist from doing things like this is about as ridiculous a thing as they could possibly do. And they know that. But the orthodontic department wants to get this over there in their department. But there's little things like this come up that ought to be done along the way. And don't sit around and wait for the child to get 12 or 14, or this gets to be a real problem then. So thank you for watching. And if you have any influence over the pediatric departments in the universities, wherever you are, they should be doing this type of work, and the general dentist can do this too. So I started out as a general dentist. I just became a pediatric dentist, just working with this. Thank you for watching, and I hope that this message gets across everywhere in the world. This can be done by anybody that works on kids. So I'll say goodbye, and we'll close out.